Hi, everyone. Thank you for joining us. My name is Chris Hayden. I'm a producer here at Fierce. And today I'm joined by Kristen Cahill, Global CEO of GCI Health. Thank you for joining
Thank
us
you for
today.
having me. It's good to see you.
Yeah, absolutely. Absolutely. So we just have a couple questions to run through. We'll just jump right in here. So, Kristen, given the evolution of pharma marketing in the recent years, what do you see as the biggest shift in the pharma marketing landscape or the most disruptive influence?
Yeah, so many disruptive
Yes.
influences. And I think it would really depend who you ask. If you were talking to a product marketer, communicator, I think they would say it's been the transformation of the media landscape, how people consume information, where patients and healthcare providers are getting their news has shifted so dramatically. I think they would also talk about the rise, which was a big topic downstairs today, of misinformation and disinformation and how that has really created so much clutter and figuring out how they break through has become so challenging. I think if you spoke to a corporate communications person, they would have to say the policy changes in the US healthcare system and just the unpredictability and the chaos that that has created. And as people within their organization who are often called upon to be the soothsayers or to have their crystal ball, unpredictability is a tough thing to navigate with your leaders. So, lots of disruptive things to
Yeah.
choose from.
Yeah. I would imagine it's hard because planning would be the hard part, right? You
Right.
plan 6 months, a year, 2 years,
Yeah.
but there's not much you can count on.
There's not a lot you can count on. But as communicators, we're used to, we're not like marketers where we plan a year out. So we do have that agility built in a little bit more. So that has been helpful. We're used to thinking on our feet.
Yes,
Yeah.
exactly. That's the
Yeah.
beauty of it. So I'd be curious to hear from you and kind of building on the last question. What are some of the most significant shifts you're seeing in how healthcare organizations are looking for communications to have an impact?
Yeah. Well, I love that you're mentioning impact because just yesterday, GCI rebranded as a health
Oh,
impact agency.
love it.
And we did that because we've been having so many conversations with clients over the past many months about how the pressure on them to deliver impact and value back to their business has never been greater. We've had so many conversations about all the opportunities to really create true impact and not just vanity metrics has increased so much. And I think also for our people, the idea that they get really inspired by our ability as communicators and marketers to create health impact, to actually change the trajectory of someone's health. So we've really rallied around this idea of impact. But I think the biggest shift is that there is starting to be a recognition that, numbers and quantitative metrics alone don't really do justice to what we can impact from a communication standpoint. So how do we start to tell a story about the more qualitative things that we can bring to the table and get our leaders buy-in on that? And that's really a shift that we're seeing
Yeah.
today.
Yeah, I can imagine. And again, this kind of builds on that topic as well. Just because today data is abundant, obviously. Everything's about data, to your point.
There is.
And technology is rapidly advancing along with it. So how is GCI Health leveraging these powerful tools to not just measure, but truly predict and optimize the effectiveness of health communications?
Yeah, we're really lucky at GCI because we are part of a broader network, Burson and WPP, and have access to some amazing AI-powered technologies and data sets. I'd say the biggest shift that those have allowed us to do is go from being reactive measurers to proactive predictors. And that comes back to the crystal ball. So we have a tool, Decipher Health, that allows us to test messages, test spokespeople in real time and predict their impact and give it an impact score. And that gives you so much leeway to be able to optimize messages and optimize narratives and stories and help to coach your executives or your spokespeople to maybe try something a little bit different and really to predict what is going to perform the best. So that's been an amazing breakthrough that technology has given us. We also have access to really deep listening tools now that allow us to get at the heart of that mis and disinformation that we were talking about and really figure out what do we need to prioritize, what do we need to pay attention to, what do we not need to pay attention to, and then figure out how do we potentially respond or how do we engage. So the ability to really go deep into the dark corners of
Yes.
the internet and see what people are saying and judge has been really interesting. And then we're also able to do so much more in terms of preparing for crises emergencies or issues. That's a lot of what communicators are having to do within healthcare organizations today. And we can do some amazing simulations, really sophisticated simulations using all of these AI tools to predict the impact of different responses to different scenarios. And that's game changing to be able to, in a world that is so unpredictable, to kind of be able to map out how you're going to respond in different scenarios.
Yeah.
So it's exciting to see.
It must be kind of fun to develop
Yeah,
some
all the tools and
situations.
tricks. Oh
Yeah.
yeah, yeah. I mean, it's scary for our clients,
Yeah.
but it's necessary.
Yeah.
And they're really fun
I
sessions.
can imagine. And even the most absurd things.
Can actually happen.
Yes,
There's
exactly.
nothing too absurd,
Oh, exactly.
unfortunately.
I know.
Yeah,
It's incredible.
yeah.
So, beyond traditional metrics, what we've kind of talked about a little bit here, but what does success truly look like for GCI Health when you're aiming to drive significant health outcomes or shape public perception?
Yeah, I think it does come back to more of the qualitative impact that we can have, right? At the end of the day, what we get excited about is this idea that we're not just creating impressions or getting people to read an article. We're actually inspiring someone to talk to their doctor. We're inspiring a healthcare provider to change their practice guidelines or change the way they approach a certain disease area. We're inspiring people to connect to information in real ways. And, when you have so many consumers now going online, doing a quick search, relying on an AI generated search outcome to guide their healthcare decisions, that's scary. But 97% of those search results are impacted by things that communications can control.
Oh,
So if we're able to really start to shape that content and shape what people are seeing, that's real impact, right? That's going to impact someone's decision making, the way someone approaches something. So we get really excited about thinking about those types of
yeah,
impacts.
97%.
Yeah.
Wow, it's impressive. So, looking toward the future, Kristen, what's one bold prediction you'd make about the future of pharma marketing?
Yeah. Well, I alluded to it earlier, but we are on a mission at GCI to eliminate impressions from
I love
our
that.
industry. We think that they are a fake metric. You put something out there, a million, billion people see it. Who cares, right?
Right.
We want to focus on real impact. So my hope is, and I think we are moving as an industry towards the acceptance that there is this mix of qualitative and quantitative, but they have to be substantive metrics in order for us to really be able to show what we're truly capable of.
Great. I love
So
it.
ban the impressions.
I love it.
That's my
I think that's
prediction.
genius. I
Yeah.
think that's great. Well, thank you so much for joining us today. We really
Thank you
appreciate
for
it.
having me. It's been great.
Of course.